Disorder and Obsessive Compulsive Disorder. So these are the symptoms of anxiety: the sensitivity of noise, dry mouth, difficulty of swallowing, palpitations, restlessness, tremor, gastrointestinal discomfort, headache, insomnia, constriction in chest, and poor concentration. So ito yung mga sintomas ng anxiety. Kung yung particular person ay naka-experience nito, ay pwedeng siya nagkakaroon ng anxiety. Next. So
Wait
general
lang,
anxiety.
excuse me, Mr. Basir.
Yes, sir.
How many of the symptoms must be present before ta makatell that it's the person has anxiety?
Depende, sir, pero most of, sir, na kapag mga 5 or 6, sir.
Okay, okay. Sige, sige. Go on.
So, so general anxiety disorder. General anxiety disorder, chronic anxiety state associated with uncontrollable worry, complements of shortness of breath, palpitation, and uh, tachycardia are relatively rare. Alcohol abuse and dependence are common in GAD patient. So when we say gender anxiety disorder, the difference between the GAD and the anxiety is the GAD is become more excessive in a 6 month. For example, yung individual na person naka-experience siya ng anxiety, kung umabot man siya ng 6 month, pwede siya maka-experience ng general anxiety disorder. So it means much more severe siya na naka-experience siya, at usually pwede magkaroon siya ng exaggerate worry or tension ng within a 6 months. So kailangan na siyang pumunta sa mga psychiatric, or kailangan na siya sa mga mental health condition. So next. So these are the risk factors that may increase the risk.
Excuse me, Mr. Basir. You
Yes, sir.
you have mentioned ganina that many are has this butanta symptoms wherein they will be dependent on alcohol consumption. Can you expound why this could be?
Concern, for example, sir, for example, yung individual particular person na uh, because of addiction of alcohol, for example, umabot na siya sa pagiging addict niya sa alcohol ng
Uh,
6 month, or even
no,
ah
you. This is part of the problem of general anxiety, right? It's not the alcoholism is just a part of the GAD. It's not an addiction in and of itself. My question is why does this thing happen? Nga ang isa ka person nga na anxiety disorder could be addicted to alcohol consumption. Ngano kaha?
Kwan, sir, depende, sir, sa particular person kung paano niya ma-handle yung stress or worry niya. Kung umabot man, sir, sa 6 month, na pwedeng magiging excessive, or pwedeng, for example, sir, na kwan, for example, depende, sir, sa particular person kung paano niya makopy yung coping mechanism niya, sir.
Okay, thank you. No, so the key word there is the coping mechanism. If a person has a difficulty in coping with the triggers of the anxiety, no, so what happens usually is they consume alcohol. Alcohol is a depressant. Okay, so anxiety is an unnerving feeling, right? So when we have an alcohol sa atong system, most likely it dampens the whole situation, no. But the problem with that, of course, is that it could lead to dependency on the alcohol, on the substance. Sige, padayon palihog.
So these are the risk factors factors that may increase general anxiety disorder. So the first one is the family members with anxiety disorder, increase in stress, exposure to physical or emotional trauma, unemployment, poverty, and drug abuse. So alam na natin yung pwedeng mag-increase sa anxiety disorder, general anxiety disorder, yun yung problema ng pamilya, yung mga physical and emotional trauma ng particular person, yung walang trabaho, yung kahirapan, yung drugs. So next, so this is the diagnosis, clinical presentation. So general anxiety disorder is diagnosed when an individual experiences unrealistic or excessive anxiety, worry for a period of at least 6 months. Additionally, the individual must have difficult controlling the anxiety or worry. So, as I said, yung kapag yung particular person ay naka-experience ng general anxiety or disorder, at least umabot siya sa 6 months, kailangan na niyang pumunta sa psychiatric or sa mga health workers para matulungan nila kung paano niya ah, para matulungan niya yung sarili niya na malagpasan niya yung trauma or yung pinagdadaanan niya, like yung mga stress or yung mga mental health disorders. So the next reporter.
excuse me. Just a correction, no. One could go to first because it's still not diagnosed, right? Given the normal scenario, one could go to a guidance counselor first. Okay? So dili sa tamo diretso sa psychiatric. Okay? Psychiatric, it's the worst case scenario ng silbi. Worst case scenario for a mental disorder. Okay? Given if it's anxiety disorder, if you have trouble controlling your anxiety, for example, if you have anxiety attacks, you could go to a guidance counselor. You could actually go to a very close friend, and you can tell it can be a cathartic experience. And then after that, if it does not help, if there's butanta really need for an intervention, you could go to a guidance counselor. Okay, and if dili na siya, if they have a hard time, ang kuan mo gud sa guidance counselor, of course they could guide, but medyo limited ang scope, because like for example, if we put it in a school setting, it can't be that the whole day ikaw ang ating manon sa guidance counselor, right? And so you could go then to a therapist. It's like hilom sa chair, hilom sa. You could go to a therapist, and then dira sa no dili sa tamo jump into the psychiatric level. Okay, so just a correction on that.
So, kwan sir, sir, may ano pa lang sir yung difference ng psychiatry at yung counseling? Di ba sir, yung counseling na more on sila lang sa advice, or yung when it comes to psychiatric na pwede siya sir sa medicines. So, pwede ba sir mag for example, yung a question lang po sir. So, for example sir, yung person na kasi minsan sir na yung counseling na for example advice, pwede naman pumunta sa psychiatric para mabigyan siya ng mga medicines sir or advisor.
Okay, so the case scenario is this: you don't go to medicine right away. Okay, so you go first in a psychologist man good. It's not just advice and guidance. Guidance and counseling, pwede. So it gives you counsel. It guides you to a more adaptive behavior. But sa psychotherapist na level, you will undergo therapy. Okay, so there's a systematic nga approach to your problem with the use of therapy, psychotherapy. Okay, and it's not a hocus pocus nga approach. It actually works ang therapy. no. Now if dili na gid siya makontrol, if dili gid siya ma in for the lack of better term, kundi siya matabang og therapy on a given range of session, dili naman po na isa ka session. Actually, the session sa therapy lasts for almost a year gani if necessary, no, depende sa cases. You don't go to the psychiatrist sa, and then if dili na gid siya dili gid walay butanta, walay remedy, walay development with the therapy, of course pwede na din mo work hand in hand ang therapist sa psychiatrist. Sa psychiatrist dira na ang medication. Example ani would be with the butanta disorder nga schizophrenia. Ang person na ay severe nga case of schizophrenia, for example, and then with a schizophrenia lisod i-undergo therapy because if manic ang person, or if na nagyoy ego collapse, wala na gyud siya touch with reality, for example. So you go to the uh, to the mental institutions na. Pwede na nimo siya ibutang og mental institution. Dito na ay medication to help with the manic nga mga butanta episodes and those problems that goes with it, the hallucinations. Pero wala na kaayo kay mabuhat with therapy. Okay? So what we're dealing with is, if manageable pa, we have 3 levels. We have the guidance and counseling, no, and then of course if needed na gid siya og in-depth nga approach with therapy, we have the psychologists. And if dili gid siya mo help with the psychologist because the person has no control over the disorder in himself, and gapos to siya threat even sa iyang family and sa iyang community, of course we go to the highest nga level. Of course we have the psychiatry, wherein nanay medication and nanay i-institutionalize na ang person. That means ibutang na siya og different ka environment wherein dili siya makapose og threat sa other people, or even ibutang siya institution para monitor og ayo ang iyang case. Okay, so that's the 3 levels ato ang gina-aim for. We don't necessarily go to the medicine diretso.
So thank you, sir, for the additional info. So the panic disorder will be discussed by my other group members.
So, panic disorder is defined by the presence of recurring and unpredictable panic attacks, which are distinct episodes of intense fear and discomfort associated with variety of physical symptoms. So, meaning, ang panic disorder is a recognized illness or a disease to someone or people who experience spontaneously seeming out of the blue panic attack. So, bigla-bigla na lang sila nagwo-worry or may malalang takot or discomfort. Ang isa din na nagiging cause ng panic disorder is thinking too much with a fear na baka na naman may mangyaring kinatatakot nila. So, panic attacks occur unexpectedly, sometimes even during sleep. So, yung panic attack daw ay sometimes even during night ay pwede din itong mangyari. Kaya nga yung may mga panic attack, sometimes hindi sila natutulog na wala silang kasama dahil baka na naman mangyari ulit sa kanila yung panic attack nila. So, we have the symptoms of panic disorder: palpitation, yung mabilis na tibok ng puso, sweating, trembling or shaking, sensation of shortness of breath, chest pain or discomfort, nausea, feeling dizzy, fear of dying, paresthesias or chill or hot flashes. So we have a diagnosis or clinical presentation. A panic attack usually peaks in 10 minutes and lasts no longer than 30 minutes. A patient is diagnosed with a panic disorder when that individual experiences repeated unexpected panic attacks, and these attacks are followed by a month period of one or more. So meaning ang tao daw ang tao daw na naka-experience ng paulit-ulit na unexpected panic attack ay pwede na itong ma-diagnose for the future over the future attack para maagapan kung ano ang maaaring maagapan.
So, for panic attacks, what is usually the first response dapat sa individual experiencing it?
Ano sir, yung panic attack?
Yes. What should be the first response?
Psychological sir.
How should they respond? If example, a person is undergoing a panic attack right at the moment. So, what should be the first thing to do?
Um, mag-breathe in, breathe out,
Pakalmahin po, sir.
kalma.
Okay,
Yes.
so
Kalma
so
po, sir.
the case here is what, take control of the situation. Okay, you cannot just say kalma dira, panic attack ka. No, it's a disorder, right? And they don't. Some people doesn't even have any clue why they are experiencing it. Not all are consciously aware of their butanta inner psychological mechanisms. No, some people wondering, anong inaniman ko? Why do I feel this way? Why do I have these panic attacks? Why do I have this butanta? Why do I have this shortness of breath, kalit-kalit, and so on and so forth? Daghan kayo og question, no? And you cannot just say, kalma lang dira. No, no, it doesn't work because the person doesn't even know why it's happening, di ba? So, one thing that you should do first is take control of the situation. As an individual experiencing the panic attack, you have to ground yourself, okay? Of course, you have to ask help to other people, no, if necessary, no, and if possible. But first, ikaw rin yung makatabang sa himself, you have to ground yourself. Itawag din siya grounding, no? Coupled with proper breathing, you have to look for a sensation to a sensation wherein you can ground your focus on. Okay, it could be tactile, it could be something that you can feel, something that auditory, something that you can hear, no? So those type of sensation, and dito nimo i-focus ang imuhang mind, no? Dito nimo i-ground, Silvi. You don't go to a panic mode of why am I feeling like this, ngano nalipong ko, ngano di ko kaginhawa, why am I sweating profusely, and so on and so forth, why do I feel so kanang unrested, no, and all of those things nga, all of those symptoms nga you're experiencing at the moment. So you have to take control, you have to ground yourself into something. Okay, that should be the first response, ha. Ground yourself into something, no? And do not, if possible, ask for help. Do not just isolate yourself, no? If need ka og help, ask for help. Okay? From of course from your significant others if possible. You can call your parents, you can call your siblings, no? In Muslim Maranao culture, dali ra kayo pangayog help because you're closely knit as a family. So, inana. Okay? So, it should be grounding. Ground yourself first and take control of the situation. Like, explain ko na, naigating, tiriring, ting, ting, tiring.
So we have a phobia disorder. So phobia disorder is irrational, overwhelming, persistent, or fear in particular object or situation. So, meaning ang phobic or phobia disorder ay ito yung may particular or specific object or situation ka na uh, kinatatakutan. So, we have three types of phobic disorder:
Uh, uh,
specific
uh,
phobia or
excuse
social
me.
phobia
Excuse
and
me. It is an irrational disorder. Okay, irrational fear rather. Huh? It's not just something that is simple na fear. Okay, let's put a categorization here. Phobic disorder is irrational fear, intense irrational fear of something. Okay. Sige, continue please.
so in specific phobia, a specific phobia is any kind of anxiety disorder that amounts to an unreasonable or irrational fear related to exposure to a specific object. So, ang specific phobia ay may specific object ka na kinatatakot lang. Kunwari, may takot ka sa uh, kuryente, wire, because may nakita ka ng tao na namatay dahil doon. Yun ang specific phobia. Yung social phobia is a fear of social situation where you may be embarrassed or judged. So, ito naman yung takot sa social situation, yung maraming tao na baka may magawa sila or na ma-judge sila or ma-embarrass sila.
Okay. So for the record, everybody has a fear of it's a very normal fear to be embarrassed. No, nobody wants to be embarrassed. It's a normal fear to be judged and evaluated. It's a normal nga butang ta scenario. It's a normal emotion. Okay? Ang kaning certain fear. But with phobia, of course, you have the extreme fear of being embarrassed and judged. Makita nimo ni sa response sa person on how they respond to the situation. Ang uban man good, maulaw, but sige na lang, mo report na lang ko for the grade. Ang uban, maulaw, but sige na lang, I should do this because necessary. But for people with social phobia, agoraphobia for example, they really go to extreme extent para makalikay ani nga situation because as I've said, uncontrollable nila ang ilang irrational na fear. Okay, so sige padayon paliog.
So, agoraphobia is a fear of places or situation that might cause you to panic and make you feel trapped or helpless. So, agoraphobia is ito yung may takot na naman sa may ibang lugar na baka mamatay sila or feel nila na matrap sila kapag pumunta sila doon. Ang example dito ay, di ba, usually marami ding mga tao na takot sa Marawi kasi may naririnig sila na may namamatay doon. So, feel nila pag pumunta sila doon, magiging helpless sila, walang tutulong sa kanila, matatrap sila doon. So, phobia disorder are common, affecting 10% of population. The patients avoid phobic stimulus and this avoidance usually impairs occupational or social functioning. Common phobia include fear of closed spaces, claustrophobia, fear of blood, fear of light. Usually maraming common na phobia is itong claustrophobia, takot sa closed na lugar. Yung feel nila na walang feel nila na nakakulong sila.
Istorya naman takot.
Hindi sila makahinga.
Ay, kana lang. Sige lang brown hair eh.
So,
Excuse
it
me, will you be discussing
therapy
the
naman,
kwan? Will you be
in
discussing the
general,
therapy?
cognitive.
Excuse me. Excuse. Will you be discussing the therapy? 'Di ba atong kwan is ang content and
Yes,
then the therapy and then the case.
yes, sir.
Were you following this format?
Yes, sir.
Okay, sige sige. Padayon pala.
Pero hindi namin sinasabi.
Hindi ano?
Cognitive behavior. Cognitive behavioral therapy, which is can work
Ay,
for
wait
those
lang.
with
Wala,
specific phobia.
excuse me. Wala presentation. And also, giambaka na to ang PTSD. Why?
Ay, sorry sir, hindi namin sir nasulat.
Ang PT, oh. Oh. Sige, sige. Continue with the therapy, please. Continue with the therapy na lang.
Cognitive behavioral therapy can work for those with specific phobia. Weekly treatment with homework assignment usually succeed in 12 to 16 session. So, ito ay natutulungan niya yung may specific phobia na ma-understand or incorrect assumption and within gradual exposes him or her to phobia source. So, para maagapan kung may maaagapan siya na,
To
di ba
overcome
usually
usually to overcome, okay,
why
because
overcome?
given the
Yes.
case na nanay gitawag nga nanay phobia, okay, mo nang nadiduol ang patient because nanay phobia, so wala na agap nga mahitabo, okay, there's no case such as that, so atong ang buhaton na lang is to get over, to help the person cope with their disorder. Okay, so munang gitawag siya CBT, Cognitive Behavioral Therapy, is of course, you need to go with the cognition first, with the mindset. As what you have said, make the person understand why they're feeling that way, no? And then make them understand the whole situation, the whole case, and then cognitive behavioral, no? From the mindset, i-reflect dito sa behavioral na aspect. Okay? So, i-correct ang mind, i-correct ang behavior, that's the whole therapy. No? Although it sounds very simple, but it's actually very intricate and systematic in its approach. Sige, please continue.
So, and therapists help them realize they are making those mistakes and they talk about realistic risk. So, yun na nga yung sinabi ni Sir na para matulungan at saka iparealize sa kanila na uh, pa-realize sa kanila kung ano ang maaari nilang gawin or dapat nilang gawin para sila ma overcome or maituon na lang sa ibang bagay yung ano yun yun lang po sir.
Okay, so next is the post-traumatic stress disorder. So this disorder can happen to a person after experiencing a traumatic event that has caused them to feel fearful, shocked, or helpless. So patients with stress disorder are at risk for the development of other
Dili siya
disorder.
stress disorder, PTSD for short. PTSD. Okay, stress disorder is different. I don't know if it's existent. Post traumatic stress disorder. Sige. If you want to shorten it, PTSD. Sige, continue please.
So a patient with PTSD are at risk for the development of other disorder related to anxiety, mood, and substance abuse. So
Again with the
sample
substance
some of the
abuse,
example.
ha, again with the substance abuse, no, the substance abuse is just part of the problem of PTSD. So isa na sa atong tan-awon when handling cases such as this, nga usahay man good ma-overlook nato ang root cause, because lagi na may substance abuse, ang approach lang dahil ni substance abuse, ang alcoholism, ang drug abuse, but naagid siya naunta siya deeper cause unta, no, and in this case the PTSD. Sige, continue please.
So some of the example of this disorder are those traumatic events such as natural disaster, accident, war or rape, di kaya yung mga na-threatened with death or sexual violence. So symptoms are nightmares, negative thinking and mood, unwanted distressing memories of the traumatic events. So parang mabalik sa kanila yung mga pangyayari na yon through flashbacks or nightmares. So because of that, they may feel sadness, fear, or anger at parang iiwas din sila sa ibang tao. So symptoms usually begin early, within 3 months of the traumatic incident, but sometimes they begin years afterward. So PTSD does not always last forever. So even without treatment, sometimes the effect of PTSD will go away after a few months. So next. Yeah, next. Next is the OCD or the Obsessive Compulsive Disorder. So it is characterized by obsessive thoughts and compulsive behaviors that impair everyday functioning. So it is a disorder in which people have recurring or unwanted thoughts, ideas, or sensations that make them feel driven to do something repetitively. So parang yung tao na may OCD ay yung inuulit nila yung bagay na nagawa nila because they make sure na nagawa na ba nila yon. So example are fears of
Dili lang man sa they are making sure that they're doing it. They're obsessive, okay? Obsessive compulsive. Obsessive means na ay obsession, right? Na ay extreme nga butanta obsession towards something. Compulsive is compulsion, meaning there's a strong desire towards doing that butanta that certain tradition or certain behavior with a obsession. For example, cleaning, okay? Clean environment. So naakay obsession with clean environment. And so when every time you're met with an environment na dirty, you have this compulsion with your obsession. So limpyuhan nimo ang surroundings. Now this is actually a good characteristic if tanaw nato, if everything considered, this is actually a good characteristic, obsessive compulsive. But we have an apelido there. The apelido niya is disorder. So, in that case, dili na siya healthy. It impedes with the person's normal daily functioning. Obsessive compulsive disorder. Napay mas worse gani, obsessive compulsive personality disorder, in which the obsession and the compulsion is crystallized within the personality of the person. Gets na to? So if crystallizes sa personality, lisod na kay siya, naka-integrate na siya sa pattern of behavior and daily living niya. Okay? So sa OCD, for example, medyo controllable because there are cases wherein dili manggod siya, dili siya embedded within the personality. But with OCD, with OCPD, embedded na siya. So lisod na siya tangtangon. Okay, it's the severity of asa siya ni crystallize nana. So, in OCD, dili lang siya nga nalang kay gusto buhaton. Buhaton nimo ni na ay compulsion and na ay obsession because na ay anxiety. It causes extreme anxiety and restlessness, or feeling of uneasiness, feeling of vulnerability, feeling of being exposed, for example, if dili ni mabuhat nga mga practices. Okay? For example, ang uban are so uh, obsessed with germs, no? Mahadlok silang magkasakit. So, naay compulsion to have this alcohol always, and in every surface nga ilang ginatouch, butangan nilang alcohol. In every hands nga ginashake, after shaking hands, they wash their hands or they wash it with alcohol, and so on and so forth. So, naay gitawag nga compulsion. Okay? So, gets na to. Dili lang siya light nga naalang kay compulsion. Naagi gitawag nga obsessive. Obsessed jud ka with that certain idea, with that certain object, with that certain state of the world, state of your surroundings, for example. And then I compulsion to act on it. Okay. One case was, there was a man nga before siya mo go for work, mulibot sa siya 10 times sa iyahang balay to check everything, ang window, ang door, tanan part sa iyahang balay. Iyang gina-check if it's locked and if it's closed. 10 times niya ni buhaton, and then aya siya ma-feel relieved nga nabuhat na niya, and then sure na gyud nga lock, and aya siya makaadto sa work. It's a disorder for that case scenario because dili na siya maka-function properly. Imagine mulibot ka 10 times. So, if dili niya ni mabuhat, what would happen? There's extreme anxiety in the part of the person, and extreme nga butanta feeling of being vulnerable on his part because he was not able to do this on a daily routine. Okay, so please continue.
Next niya yun. So, next is the non-pharmacological treatment. So, it is the pain therapy that refers to intervention and do not involve the use of medication to treat the pain. So, some are the psychological education, short-term counseling, stress management, psychotherapy, meditation, or an exercise. So, first is the psychological therapy. So, it is a collaborative space to explore the client's difficulties in a safe and confidential setting. So, it is a talking therapies that are generally considered first-line treatments in all anxiety disorders because they provide a longer-lasting response and lower relapse than pharmacotherapy. So, this is a talking therapy that involves talking about client thoughts. Through this therapy, a person who have an anxiety will have a better understanding of their own thinking and behavior. And matututo din sila on how to solve their own problems. And also, they can change their behavior and improve their quality of life.
So, thank you. Talk therapy came from who? Which therapist? Which therapist was that? Talk therapy. So, anyone sa reporters. Talk therapy was what? Ang kinsa na siyang originate? Catharsis. The term catharsis, wala. It's kang Sigmund Freud. Okay, so talk therapy, as mentioned, you will be talking with the therapist. In the therapist will actually lead the therapist will actually lead the conversation butanta, towards attaining some answers and while asking some questions. Okay, so the therapist will lead you towards the answer. Sa self-centered therapy, they will lead you to the answer. No, ikaw mismo, in some cases sa talk therapy, ikaw mismo ang mangita og answer sa imong own problem. no, by leading you towards the answer. No, and of course, it also helps because you will be discovering some aspects of yourself that you were not able to observe on a personal basis. But when talking with someone, a professional, most likely makashed sila og light on why you act and why you feel that way. Makahatag sila og suggestions on healthy adapting ang mga methods, for example. Sige, continue please.
So the antidepressant most widely prescribed for anxiety are SSRS such as Prozac, Zoloft, Paxil, Lisapro, and Celexa. SSRIs have been used to treat generalized anxiety disorder or GAD, obsessive compulsive disorder or the OCD, panic disorder, social anxiety disorder, and post-traumatic stress disorder. That's
So this is the end of our discussion for the group 1. So thank you for listening us.
Okay, thank you. We still have time for the other. No, taas na po, no? We still have time for the next group, the mood disorders. Wala ta nag-obey sa format, no? Ang format was to post a to post a case, no? To post a case for one of your disorders ana nga category. But anyway, still please send me the PPT and kato inyuhang pre-recorded nga report, no? Ikuan gyapon to, i-send gyapon to sa froilanmax@gmail.com para ma-document nato. So, next group, Plihog.
For a while lang, sir.
Sir, pwede pa key-chat box yung email niyo po?
Hello.
If you're ready, please do proceed with the reporting.
Yes, sir. Sorry.
Ah,
Okay, so good morning, everyone, especially to Sir Bakapil. So before we are going to start our discussion for this morning, let me let
I would like to say thank you to Sir Makapil for giving us another chance to deliver or to discuss our side topic. So, thank you, sir. So, okay, so let me introduce myself. So, I am Lukman Alaya, and my members are Miss Minalang Asisa and Miss Pasandalan Nershida. So, the topic that we are going to discuss for this afternoon is about mood disorder. So, before we are going to proceed, let me define the word mood and the disorder. So, mood is a temporary state of mind and feeling, while the disorder is a lack of order or regular arrangement or the confusion. Well, it is a condition that is characterized by a lack of normal functioning of physical and mental processes. So, what is mood disorder? Next slide, please. Okay, mood disorder is a psychological disorder in which there is a primary disturbance of mood. Illness under mood disorders include major depressive disorder, bipolar disorder, or mania, euphoric hyperactive, overinflated ego, or unrealistic optimism, persistent depression disorder, long-lasting low-grade depression, cyclothymia, a mild form of bipolar disorder, and SAD, or the seasonal affective disorder. So, wait, wait lang, sir. Okay, so I think we are very familiar, or we are familiar in this kind of mood disorder because mostly or mostly or everyone I guess is experiencing this kind of mood disorder, which is from the word mood swings. Is ito yung pabago-bago tayo ng mood minsan, like sometimes galit tayo or bigla-bigla na lang tayo nalulungkot without knowing the specific reasons kung bakit. Because yun nga, we are not in the good mood, and then sometimes with this mood disorders nakakagawa din tayo ng mga decisions sa life natin na at the end is pinagsisisihan din natin because nagagawa natin yun kasi we are not in the good mood from the word hindi tayo nasa good condition. That's why we made the decision na at the end is pinagsisihan din natin. Okay, so next slide please. Okay, so with this mood disorder includes the depressive disorder. So what is depressive disorder? So this depressive disorder, it is a treatable medical illness involving an imbalance of brain chemicals which is called the neurotransmitters and peptides. It is not a character flaw or a sign of personal weakness. Yes, this is very true. Now, when we are experiencing this kind of mood disorder, doesn't mean that we are weak because we're just human and it is normal I guess to experience this kind of mood or this kind of mood disorder kasi and not all the time is nasa good condition tayo or nasa mood tayo. So it is very normal I guess to experience this kind of mood. So
Excuse
episodes of
me.
bipolar
Excuse me. It
can feel
wouldn't be
like
normal.
marital problems or a
Excuse.
date of a loved one. So
Excuse.
yes, one of the cause of this
Excuse,
yes,
Miss Alea. No, correction. It wouldn't be normal to experience this disorder. Okay, so that's number one. And
okay,
number
sir.
two, yes, it's not a sign of personal weakness on the account that everybody has their own uh, clink in their armor. No, we have our own personal weaknesses with our own personalities and upbringings. Nagite atong own, and then when the right problem comes with a perfect storm, of course, a person can experience depressive disorder. It's not normal, but we should again. I like to appreciate what you're implying is that it's not a personal weakness. Everybody can experience this disorder in their life. Okay, such like experiencing any sickness. Okay? So, if maghilantan ka, wala man gyud musulti nimo nga, uy, kawik ba nimo lawas? No, so no, no. It's actually uh, it needs it needs medication, no? Just like depressive disorder, no? If maka-experience ang isa ka person ani, of course kinahanglan pud siya og help. But depressive disorder is not a normal nga occurrence. No. It is common but it's not normal. And also, depressive disorder is different from being sad. Okay? Being sad, as what you have proposed ganina, of course, it's a normal nga scenario that not all the time we are happy, and at some point we feel sad, no? And at some point we feel really sad, and at some point we feel really, really, really sad. But again, sadness is not depression. Okay? If to put it simply, depression is feeling empty. Okay? Not sadness, but feeling empty. Okay, so palihog ko pa dayon.
Okay, sir. Sorry for that false information. Okay, so episodes of depression often follow stressful events like marital problems or death of a loved one. So yes, I think one of the cause of this depressive disorder is because sometimes this marital problems or the death of loved ones means so people who have recurrent episodes of major depression are sometimes said to have an unipolar depression because they only experience periods of low or depressed mood. So the exact cause of depression still are not clear. Well, yes, this is very true because as of now, hindi talaga natin ma-identify or ano yung exact cause ng depression, which is ang alam lang natin is stressful environment. Ang alam lang natin na reason is yung mga stressful environment or a life situation na nagiging dahilan ng cause ng depression disorder. Like, di ba minsan we experience this depressive disorder because of our environment that we are surrounding or kung ano man yung situation natin sa family natin or in general na problem natin sa family, like family problem, personal problem, or anything that is problem that is contribute to the cause of this depressive disorder. So sometimes or other illness or medications can cause or mimic situation. I don't know how to pronounce this one, but
Mimic.
correct me if I'm wrong. Okay, mimic. So mimic situation of depression. So it is important to have a complete physical examination. So yes, when we are experiencing this kind of mood disorder, I think it is very important to consult a psychiatrist or a counselors for us to help kung matulungan nila tayo kung ano man yung mga pwede natin magawin to overcome this kind of mood disorder para hindi siya lumala na mag-cause siya ng major problem sa life natin. So it is very important na mag-consult tayo ng psychiatrist or the counselors when we are experiencing this kind of mood disorder.
Stop shouting.
So next slide please. I wait. Okay, so before we are going to proceed to the other symptoms, let me mention the sample case of this in relation to this with depressive disorder. So a 15 years old Puerto Rican, and she is a female. The adolescent was previously diagnosed with major depressive disorder and treated intermittently with supportive psychotherapy and antidepressants. Her more recent episodes relating to her parents are the marital problems and her academic or social difficulties at school, while she was treated using cognitive behavior therapy. So, kaning si Puerto Rican is na-experience niya yung depressive disorder and ang cause nito is the marital problems and stress siya sa school or sa activity, kung ano man yung nangyayari sa kanyang academic, especially in our current situation which is this pandemic, and everyone I guess is nasa stress dito sa online class. So, but Next slide, please. Okay, so now let's go proceed to the other symptoms of this depressive disorder or the mood disorder. So the first one here, as you can see, is we have here the prolonged sadness or unexpected crying spills. So yes, when we are experiencing this kind of disorder, is minsan, di ba, I think na-experience natin to lahat na minsan is bigla-bigla na lang tayo nalulungkot or minsan na bigla-bigla na lang din tayo naiiyak na hindi natin alam yung reason. Kasi yun nga, as what, kagaya ng na-mention ni Sir is, we are empty. So, kaya yun yung dahilan kaya na-experience natin to. So the second one here is we have the significant changes in the appetite and sleep patterns. So yun nga, pabago-bago yung mood natin and then nati-change din yung appetite natin, like appetite natin like when it comes sa food, hindi nawawalan tayo ng kanang kumain and then yung sleep pattern natin, yung sleep routine natin is minsan hindi rin tayo nakakatulog ng mas maaga kasi hindi tayo makatulog because ang dami nang iniisip because of this disorder. We are experiencing this kind of mood disorder. So
Okay,
the next one here is we
excuse
have the
me.
irritability.
Excuse. The significant change in appetite
Yes,
and
sir.
sleep patterns are actually in both ways. No, it could go both ways. Increase in appetite or decrease in appetite. There are people who are depressed that were reported to have increase in appetite. No, and sleep patterns, of course. Some people who have depressive disorders experience changes in sleep patterns. For example, longer sleep in the day during daytime, and they are awake at nighttime, which doesn't normally occur. Okay, for example, with appetite, in Animagudi, when of course you feel sad, you feel empty, you feel worthless. For example, all of those things that's posted there. For example, and so for example, eating is one of the main basic pleasures in life. So if one feels empty, magod, of course it's a case to case basis. There are many people who feel empty. What they usually do what they usually do is they try to fill in that void, that emptiness, that what they call quote unquote sadness by trying to eat. Maybe they would feel happy, maybe they would feel the pleasure, the zest again in by eating their favorite food, sweets bakaha, and so on and so forth. And so they have this what increased in appetite. And for some cases in depression, they don't really have this increase in appetite, but the opposite, decrease, because of the overwhelming emotion that they encounter at the present, the overwhelming negative emotion. No, so that and also to put it in a summary, all of the symptoms that's posted here are negative affect ng mga symptoms. Negative affect siya in terms of sadness, in terms of irritability, anger, worry, agitation, anxiety. These are all negative affects, negative emotions, no? So that's one of the keynotes there sa symptoms nila. Sige, please continue.
Okay, so the next symptoms here is irritability, injury, worry, or agitation or the anxiety. And I think familiar na sa atin to, yung itong mga word na to. So the next one here is the pessimism and deference. So sometimes nakaka-experience din tayo na feeling natin is naiiba tayo or sometimes na parang natatanong natin kung bakit nasa situation tayo na ganito or bakit ganito yung buhay natin. Yung mga ganun. Kasi 'di ba, natatanong natin 'yan kasi we are experiencing.
For a while lang, sir.
Reporters, are you there?
Sorry, sir. Gonna distract ko, sir. Okay. So the next one here is the loss of energy or the persistent lethargy. So, yes, isa din to sa mga symptoms na minsan nawawalan tayo ng energy. Minsan hindi natin gustong bumangon kasi nga yun nga wala tayong energy. Kasi, na-experience, kasi yun, okay, so next one here is the feeling of guilt or the worthlessness. So, minsan, feeling din natin is guilty tayo sa lahat ng bagay or minsan feeling natin wala tayong halaga and then dito rin pumapasok yung thinking na what if mag-suicide ako or ganito, ganyan. Kasi yun nga, feeling natin wala tayong halaga sa lahat ng bagay. So the next one here is the inability to concentrate and the indecisiveness. So yes, this is true because sometimes hindi talaga tayo nakakapag-focus or nakakapag-concentrate kung ano man yung ginagawa natin. Like for example, nag-aaral tayo but we are experiencing this kind of mood disorder or this kind of disorder is hindi tayo nakakapag-focus, nawalan tayo ng focus and then ang magiging result nun is nagiging baksak tayo sa mga activity natin, nagiging um, poor yung academic performance natin because of hindi tayo nakapag-concentrate. Kasi yun nga, we are experiencing this kind of disorder. So the next one here is the inability to take pleasure in former interest and social withdrawal. Yes, so minsan nawawalan tayo ng interest sa lahat ng bagay. Feeling natin, for example, sa mga students, minsan pag na-experience nila yung ganitong disorder is minsan nawawalan sila ng interest na ipagpatuloy yung pag-aaral nila, especially in our current situation na pandemic. I think in our situation ngayon na pandemic is mostly sa mga not only the students but also the teachers as na-experience nila yung mga ganitong mayroon na nakaka-experience ng ganitong disorder which is nawawalan sila ng interest na magpatuloy kung ano man yung ginagawa nila. So, yun. So, the next one here is the unexplained ache and pain. So, hindi natin minsan na-explain yung nararamdaman natin or kung ano man yung sakit na nararamdaman natin. So then the last symptoms here is the
Excuse
recurring.
me, in unexplained aches and pains, no,
Yes, sir.
some suggest that it's what you call psychosomatic disorder. These are just psychological in nature, pero na ma-express siya sa lawas through the sensation of pain and aches, no. Pinaka common would be backache, no, stiff neck and those sort of stuff, no. It could vary from patient to patient, but it's actually what you call psychosomatic disorders. Sige, Paleo,
Okay, sir.
continue.
Thank you for that additional information. So, okay, so the last one here is the recurring thoughts of it or suicide. So, as what I mentioned earlier, na when we are experiencing this kind of disorder, is dito talaga pumapasok yung mga thinking na suicide. So, yun. So, for the next topic, we discuss number Miss Minala Asisa.
So, different kinds of depression. Unipolar depression or clinical depression experience periods of low or depressed mood where saan yun? Uh, asama ang wait lang sir. Where a person kanang maka-experience og depression nga nasa major state na siya sir. Dayon ang persistent depressive disorders often called dysthymia may have less severe symptoms but experience a depressed mood that lasts for at least 2 years. Murag parehas lari sila sa unipolar depression pero kanina siya naara siya kuan time sir nga mawala siya sir like 6 months or 2 years sir. Mood disorder symptoms also can arise after a woman gives birth with postpartum depression. Like sample ani sir kay murag katong sister-in-law na ako nga after niya nga mag-give birth sa akong pamangkon sir kay nagka-experience og postpartum. Kada stress niya sir kay sa iyang anak niya maikuan tanan iyang kalagot sir.
Okay, so
And di kan
anyway, excuse me. Postpartum disorder is an interplay mo good with uh, the different factors such as number one would be ang woman na siya anak, no? And it's not an easy Lexis, keep quiet. It's not an easy factor to comprehend in your life. No, dili siya easy. No, I'm not saying this in a negative manner, but having a child is one of the biggest butanta is one of the biggest event in your life as a person. So it's not an easy thing to put into reality, to put into your reality, to fit into your reality. So that maybe kana. And also the factor that one's life will be really changed, no? And usahay man good, in some cases the woman is not conscious of her butanta psychological processes. She's not conscious of all of this, no? It could come in an unconscious nga way, no? The realization, the weight of the scenario, the changes in your life, the changes in your body, the pain that you went through, no? Ang kasakit while pagpanganak that you went through as a woman. What else? No, the things that you have to surrender as a woman in relation to your role as a mother as of the moment, no? Mother na ka, wife ka, given, no? So all of these things interplay in a psychological nga aspect niya. So dili siya dali i-comprehend, and in some cases this could translate into the what we call postpartum depression. And in some cases pod, or maybe dako akong duda that it's a mix, that there's a hormonal nga factor, no? That at that point there's a butanta, your hormones are out of whack, no? Gikan kag pagpanganak, no? Gikan ka og ordeal nga grabe ka, dili dali nga ordeal, no? For women nga wala pa nanganak, ang pagpanganak is an ordeal nga grabe intense in terms of its weight and significance. Now, what would happen is that all of this interplay mixed with each other could cause gitawag nga postpartum depression. Okay? And it could vary, the expression of PTSD could vary from person to person. Dili siya gitawag nga unique, no? Ay di siya gitawag nga homogeneous or similar for each case. Nagyoy na lahi-lahi nga expression for this, no? Sige, palayo ko pa dayon.
thank you sir. And they can sometimes be accompanied by psychosis, psychotic depression, which this psychotic depression experience delusion and hallucination sir. And or can occur during the winter season. Ang seasonal affective disorder is when during
So
winter
sige,
season nga
to put it into context, no, seasonal affective disorder, pinaka-common siya sa mga countries nga na ay winter season. During winter, it's cold and it's damp and it's makulimlim, no? And you're not butanta at your best nga At the best part wherein you can meet people because lagi na snow and so on and so forth, na gitawag nga seasonal affective disorder. Musulod ang depression during those times of being lonely during winter times. No, sa ato adri would be the rainy season. No, for example, there are many people who has the onset of seasonal affective disorder during the makulimlim season. Dag-om, ulan-ulan, you're away from your family. All of those factors involved mixed, no, with unique circumstances sa imuhang genetics and sa imuhang psychological processes could have an butanta could result in what you call the SAD or seasonal affective disorder. Ang nakanindot lang ani nga disorder is of course you know that it's coming because you have the hint from the seasons, and ang nakanindot lang pud niya, no, it's not really nindot, no, ang on the positive note lang is that it's manageable, no, it could be managed, no, in a way because you know the butanta that the trigger, but of course you have to look into the root causes. Okay, so please continue.
So, mao to katong giingon ni sir nga during seasonal changes nga maka-experience og koan depression during seasonal changes. So, bipolar disorder, also known as manic depression, because a person would can alternate between the pulse of mania high and depression, which is low. It is treatable illness marked by extreme changes in mood, thought, energy, and behavior. These changes in mood or mood swings can last for hours, days, weeks, and months. It differs significantly from clinical depression, although the symptoms for the depressive phase of the illness are similar. They talk about experiencing highs and lows, periods of mania and depression. These swings can be severe, ranging from extreme energy to deep despair. The severity of the mood swings and the way they disrupt normal life activities distinguish bipolar and mood episode from ordinary mood changes. So, ang bipolar disorder where people with bipolar disorder frequently display extreme intense and disturbing emotional state known as mood episode, extreme happiness or excitement, which is mania, and melancholy, which is depression, are typically symptoms of mood episodes. People with bipolar disorder can also have normal moods occasionally.
Disprayan yung namatay ra.
So here's the symptoms of mania, the highs of bipolar disorder: heightened mood, exaggerated optimism and self-confidence, excessive irritability, aggressive behavior, racing speeds, racing thoughts, flight of ideas, and reckless behavior, prolonged sadness or unexplained crying spells, significant changes in appetite and sleep patterns, inability to take pleasure in former interests, social withdrawal, unexplained aches and pains, reoccurring thoughts of death or suicide. Murag katong gi-explain ra ni Miss Lukman last nga mga symptoms, sir.
Yes,
So last,
it's excuse me, it's the same, no, but actually it has the high aspect, the mania nga aspect, no. And this is actually isa sa pinaka kaning controversial nga disorders because it could, excuse me, unsa man kasi butang dira put dira. It could actually be misdiagnosed for borderline personality disorder, no? Ay ang borderline personality disorder isa sa pinaka complex nga disorders nga exist because iyahang symptoms cross between other disorders nga makit-an nimo, no? But in bipolar disorder, for example, all of these are part of what you call uh, the symptoms na siya ginagmayng part dira sa gitawag nga uh, bipolar disorder o sa borderline personality disorder, no. And ang isa sa nakalisod ani during diagnosis is that uh, lisod ni siya i-diagnose with children because because of the because of the nature of children to be really, no, butanta ang mga bata mo are actually kuan yun na sila lihok, no, nice, so nay high, no, but the thing with that is it's a normal high man god, it's not a thing, it's not the same as a bipolar nga mania, but yes, children are generally hyperactive good, so dira po na nakalisod sa iya, no? So it's the same in some sense because there's still depression, but in that case the mania is part of the whole depressive disorder. Sige, paliw ko continue.
So the next slide will be explained Miss Pasandalan, sir.
Okay, so of bipolar disorder, we have the types of bipolar disorder. So, the bipolar one, it has two types of bipolar disorder. So the bipolar one disorder, it talks about the characteristics characterized by one or more manic episodes or mixed episodes. Typically, a person will experience periods of depression as well. It is marked by extreme manic episodes. So, just always remember guys na ang bipolar 1 disorder na illness is it has a manic or mixed episodes na hanggang at least maabot siya hanggang 7 days according to my research, and may pagka-severe siya, yung malala na effect na mga symptoms na kailangan importante na madala yung tao na yon sa hospital if he has experiencing the bipolar 1 disorder. Also, it has a depressive episodes na naabot hanggang 2 weeks. So, ang bipolar 1 disorders summary niya ay wild siya na effect doon sa tao. May pagka-strong, may pagka-extreme, may pagka-exaggerated, ganun. So, bipolar 2 disorder, it is diagnosed after one or more major depressive episodes and at least one episodes of hypomania with possible periods of level mood between episodes. The highs in bipolar 2 called hypomanias are not as high as those in bipolar 1, which is the manias, and bipolar 2 disorder is sometimes as major depression if hypomanic episodes go unrecognized or unreported. So, ang bipolar 2 disorder ay opposite siya doon sa bipolar 1 disorder, which is ito naman ay may pagka mild effect, yung calm lang, yung sakto lang na effect doon sa tao. It is
sakto
a
lang. There's no such thing as a sakto lang because we're talking about this disorders, no. So sige, to put it into context, bipolar 1 has a marked extreme manic episodes. Mas extreme iyang manic episodes. Mas grabe iyang racing thoughts, no. If you had an experience with gitawag ADHD, no, those are hyperactive pagani di pagina siya manic, no. Mas severe ang manic, no, wherein mas
yes sir,
ang thoughts nila ga-race to the point that their mind cannot catch up with their thoughts and the feelings of euphoria that they're having up to the moment, no. But ang lisod lang ana is mas taas ang swing mas taas ang swing sa opposite side, bipolar, right? Duha ka poles. Mas taas ang swing
Yes,
sa
sir.
pikas pag balik ana sa opposite pole, of course, extreme po jud kaayo ang gitawag nga depression, no? So ang gibutan diri sa bipolar 2, the highs in bipolar 2 are called hypomanias, are not as high as those in bipolar 1. Bipolar 2 disorder
Yes.
is sometimes has a major depression, no? Major depression, mas emphasized ang iyahang depression. So inana.
Yes. So, as what Sir Max mentioned, the hypomania. If you are experiencing hypomania, the person, your energy level is may pagka higher siya kaysa sa normal energy, and also it causes I think it causes problems in your life big time. That if you are being transparent, very transparent, and that's why if you have a hypomania, you are a parang you are easily being read by the other people. Minsan yung na search ko po, sir, minsan yung sa hypomania, minsan nagiging very happy ka, yung talagang happy talaga, and minsan naman yung pagka very irritable ganon. So but take note that pwede mo din ma-enjoy yung mga emotions given by the hypomania. And also the additional for the bipolar 1 disorder is yung tao na yon ay pag yung tao na yon ay naka-experience ng bipolar 1 disorder, ay maka-experience siya sa full manic episodes, which Sir Max mentioned earlier na may pagka very abnormal effect, may pagka oh yes, may pagka very abnormal effect na behavior sa isang tao, yung mga exaggerated extremes, yung example ay nagiging hallucinate yung tao, nagiging delusionada, na nawawala na siya sa reality, nawawala na siya sa sarili niya, parang nagiging value na siya, I think. Yes. So, next slide please.
Uh, Baliw is different pud siguro, no. So schizophrenia
Ay,
is different, no. Anyway, let's pila ka kuan slides remaining, no,
ito lang
Sheila?
sir yung last.
This one.
Ito lang
Okay.
po.
The other wala na, no. So the other nga
Oh,
kuan
last.
reporters would be presenting for the next meeting, ha. Let's have the
Yes,
same
sir.
setup such as this. So let's just wrap up this one na lang.
Yes, sir. So, let me continue my discussion. The depressions in bipolar disorder are mood disorders, the real physical illnesses that affect a person's moods, thoughts, body, energy, and emotion. Treatment to these illnesses can also have the ups and downs. So, yun nga yung bipolar disorder ay about the manic episode illnesses na may dalawa siyang mood, which is the two extremes effect, I guess, yung may pagka-depressed, which is the low, and the manic, which is the high. So as you can see, we have the effective treatment can help you to can help you na can help you too, which is the first one is it can help you to reach your goals, for example by helping reduce symptoms such as fears or disinterest. Number two, the build on the strengths you have and the things you can do, very understandable yung mga yung pagbe-build ng strengths na ma-motivate ka na magawa mo yung bagay na yon. In the third one is to develop a person-centered wellness plan, and the last one, it can help you to live your life without the interference of the symptoms. So that's all, sir. If there's any questions, right.
Okay, thank you so much, reporters. We had two
Yes, sir.
sets of reporters, no, two groups for this meeting. Thank you so much. The other set would be scheduled next meeting, Friday. Oh no, Friday meron. Tuesday next meeting, no. And then after we have covered the whole the whole topics na. No, we will answer. You will answer the worksheets that you missed for one chapter 2, chapter 3, and no, rather group 1, group 2, and group 5 and group 6. Everyone will be answering this. No, the quizzes will be. Let's have the quiz later. No, and then our semifinals exam would be uh, covering from chapter to chapter, end to end. No, that's a semifinals exam. And on our finals, we'll have role playing film. No, so you will be having a role playing activities nga project.
By group
No.
mission, sir.
Yes, of course, by group. Lisod kayo mag-roleplay. Ikaw, Raisa. No, so that's it for this morning. Thank you so much, no, for your effort to in coping with your lacking mga grades. Thank you so much for your effort, everyone. I'll see you all next meeting. By the way, this reporting session is made live through YouTube. No, I'm just laying it out there para natay documentation.
Sir, kwan sir, na-send ko na yung kwan sa through Gmail yun na. Sir, sa about sa role play sir na kwan. Kami yung mag-select o ikaw sir?
Ang sa groupings ninyo sa reporting would be
Role play.
the basis for the role play. Ha? But that would be on the finals na. That would be on the finals. I will be giving you the exact format on sa cover and what to do. Okay?
Yes sir.
Sige,
Yes,
sige.
sir.
So, sige, mamahaw sa ta. No, I know, wala pa man pamahaw. And then, nilapas na tag 9, you still have classes to attend to. Thank you so much for your time. I'll see you all next meeting, Group 5 and Group 6. And for those nga naka-report na and are present, I'm taking note of your names. Thank you so much. No, thank you so much, everyone. Goodbye.
Thank you, sir.
Thank you.
Sir.